there is a concept that is very interesting. Is the one of the most referenced concept in the literature, that is learn and use. It has been a concept that has grown within the CI therapy. It's an essential concept in CI therapy. I'm going to ask you, why is the concept of learned use an essential concept in neuroscience and then in neurorehabilitation? Why a therapist or a researcher has to know about this concept of learn and use?
Yeah, it's a very interesting concept clinically, and as you mentioned, the idea informs CI therapy. The idea came from studies of monkeys, deafferented monkeys, whose sensory input from one limb was unavailable to them, and that led them to not use that limb. So much so that they alienated the limb, that they started to self-mutilate and cause damage to that limb. That is how they were not aware of that limb. Now, the reason why this became an informative thing for CI therapy was to get at the point that when you have such an injury where one limb is restricted, you tend to use the other limb a lot. The other way that this has developed over the years is through the idea that non-use can be a problem in the clinic, because patients may have sufficient capacity to use their limb, but have learned not to use them over time, probably due to reinforcement of certain signals. So getting negative reinforcement by using their pharetic limb, and positive reinforcement by using their good ipsilesional limb. So it's important in the clinic because the value of providing therapy may be limited if we do not identify cases where there may be learned non-use of the limb.
There is an implicit assumption behind current approaches or conventional therapy that the improved motor capability or capacity after intervention will automatically promote the spontaneous functional use of the pharetic hand. And in an article, I don't remember what, you say some data about the 52% of patients didn't incorporate the pharetic hand in daily activities, or even in those patients with full motor recovery, 27% reported reduced hand use in daily activities. So it seems that the use of the upper limb doesn't depend only on motor capacity. And that's a shock for many professionals that has that implicit assumption, as I said. So if non-use doesn't depend only on motor capacity, what other factors influence it? How can we understand this learn and use on a scientific basis?
Yeah, we in a separate study, we studied this phenomenon of learn non-use using an experimental approach, a task known as the actual amount of use test. And I will describe that test in a second. But what we found were the other factors other than capacity that seemed to tell us something about use behaviors were related to motivation and arousal. And arousal was a term we use for general attention, not to any specific field, but overall attention to the task, as well as motivation, which we gathered that from a test called the confidence in arm and hand movements questionnaire. The actual amount of use test, which was the test that we used to assess use, is quite interesting. The modification of that test is what we used, and the modified test has two components. There is a forced use component and a spontaneous use component. But what's really cool about the actual amount of use test is that participants who come into the research study are unaware that they're being tested. They're debriefed at the end. So we use Yes, they're blind. Exactly. They're unaware that things are happening. Use a video camera, and we incorporate a set of 14 tasks into a narrative that suits them. So they come in and we give them their consent forms, and we ask them to sign it, and then we ask them to handle an album that we give them, and they'll tell them to just peruse it, and so on and so forth. So there are a number of tasks that they do. They don't know that they're being tested, so they spontaneously use the arm that they would use to perform this task. And so that's the first batch of 14 that we do in the spontaneous component. We then have them do the forced component. We ask them explicitly to use their pretic limb to do these tasks. And that gives us an indication for their capacity.
You then evaluate the difference between the spontaneous and the forced.
And the forced to get a sense for the degree of non-use. So learn non-use, in the way we define it, is despite having the capacity to do a task, that you don't spontaneously choose your pretic limb to do it. And so the difference is how we evaluated non-use in that study. And what we found was the thing that influences it, was associated with it, were factors related to motivation, as we measured in the self-efficacy questionnaire, the CHM, as well as arousal. Those were the other things that we found were useful. There are some tasks in the AUT that are bilateral in nature. So clearly, when you have two hands that need to be used, asking someone to just use the pretic hand is also not necessarily optimal. So I evaluated the spontaneous bimanual use in one of my studies. And what we found there was, in using both hands, the other thing that really matters is the task that they're doing and the side of creases. So if you needed to use your left hand for something that required a stabilizing component and your left hand was pretic, you would tend to use it more, as you would expect. So those kinds of bimanual use differences were parsed out in one of the other studies that we did, and their site of lesion, or the site of hemispheric damage, seemed to be an important factor too.